Hey there, I'm Dr. Michael-Renee Godfrey. I'm a licensed professional counselor in Ackworth, Georgia, and I'm here to talk to you today about the what, when, where, why, and how of therapy. What is therapy? Psychotherapy, therapy, counseling, mental health counseling. You hear all those terms kind of used interchangeably, but they are a little different. Psychotherapy and mental health counseling involve evaluation, diagnosis, and treatment of mental health and behavioral disorders. But mental health counseling typically provides a shorter term support that is more solution focused rather than managing chronic symptoms of a mental illness. Counselors don't typically aim to develop a long-term relationship with their clients. Maybe 4 to 12 sessions is what is considered solution focused. And they're typically master's level clinicians. Psychotherapy, on the other hand, is a longer term process of treatment that identifies emotional issues and psychological problems that have been built up over a course of a long period of time. It examines the background and difficulties of a problem and helps you understand your feelings, thoughts, and behaviors more clearly. What therapy is not, I think, is a more critical point to make. There is such a negative stigma about mental health counseling, psychotherapy, and the like, and there doesn't need to be. So let's talk about that. It is not a big complaining session where you just come in and dump and then leave with no resolution. It's not about placing blame on anyone, your parents, your significant other, or your spouse. It is not the coward's way. Cowards run from problems in their lives. It takes courage to come to therapy and look in the mirror and deal with your stuff. Therapy does not show weakness or even imply that you are not strong enough to handle your problems. It is not a mind fuck. It is not brainwashing. It is none of those things. It is not the coward's way. Cowards run from problems in their lives. It takes courage to come to therapy and look in the mirror and deal with your stuff. So when should you go to therapy? Lots of different reasons. You might have a lot going on right now, and you're just having trouble processing the things in your life. Maybe you have a shorter fuse than usual, and it's affecting your mood, your relationships, or other areas of your life. You just don't feel like yourself. Maybe you're no longer enjoying the activities that you used to. You're starting to sabotage your relationships. Maybe you feel like you've run out of resources. You feel stuck. Or you want to improve yourself, but you don't know how. You can't talk to friends and family about what's going on, but you want to talk to an unbiased person that you can trust. That's where a therapist comes in. In my experience, more women come to therapy than men. I think it's more accepted for women to come to therapy than men. And especially with people of color, it's a real stigma to have to reach out to somebody. Let me explain what I'm talking about, because this really is close to my heart, especially for Black men. The struggle is real, y'all, okay? And I don't claim to know the half of it, being a Black man in America. But I know that it's not what it used to be. There are expectations from society, expectations from spouses, expectations from baby mamas. There are expectations at work. There are expectations at the church. And y'all are pulled on in so many different directions. And then you get in your car and you hope that you don't get pulled over, because that might mean your life. I cannot imagine the burden that y'all carry? Who protects you? Who listens to you? When you just want to talk about it, when your ideas aren't working and you just want to sort them out, you can go to therapy to talk about all that, because therapy is totally confidential, okay? Unless you try to kill yourself or you tell us that you're going to kill somebody else, okay? There are limits. Again, therapy is not about you not being able to handle your problems. It takes much more courage to face your issues and want to be a better person and then do the work. I encourage you to find a therapist. You have your choice of race, gender, ethnicity. Now, black male therapists are bits of unicorns, right? They are hard to find, but they are out there. I've been there too. So go see a therapist who doesn't want to nag you, who can sit there if you don't know what to say, who can maybe help you figure out what you're feeling. So here's the biggest question I get, right? Why should I see a therapist when I can just talk to my friends? Y'all let me know how that's working for you, okay? Because our friends don't always have the best advice, do they? It's your choice, of course. But just know we're here. So where do you go to therapy? In this age of the pandemic, it's not always face-to-face or in person like it used to be. Now we have online asynchronous platforms where you can text or chat with your therapist. You have a therapy room that's open 24 hours a day, and your therapist will answer your text messages once or twice a day. We have video conferencing like Zoom for healthcare. There are groups, support groups, grief support groups. Of course, there are addiction groups that you can go to so that you're not just one-on-one with therapy. The one thing that I will tell you is that your therapist must be licensed in your state of residence, okay? This gets confusing, but wherever you are legally a resident, your therapist must be licensed in that state. If you go away on business or vacation or you go off to school, that's fine. You can be anywhere in the world as long as your therapist is licensed in your state of residence. I think I covered everything. If I didn't, feel free to leave a comment below and I will certainly try to get back to you. I just wanted you to know what therapy really is and what therapy is not. So, thanks for coming by today. This is another episode of The Cut.